Hi, this is Mary. I just wanted to report to you and let you know that I'm 3 weeks out of gastric bypass surgery. Well, tomorrow will be my 3-week surgiversary, as a lot of people say out there in YouTube land. I went to the doctor just now, and I have lost a total of 56 pounds, according to the doctor. Now, I've gained about 3 or 4 pounds since my lowest weight that I weighed here at home. Of course, now you know that the scale between home and the doctor's office is always different, right? Well, that's true, but I had gotten down to 238, and then I went back up to 241, and I've been toggling between 239 and 241, and it's really kind of got me down to the dumps because I'm like, ugh, come on, people, let's get through this. I really want to, lose, no gain. So I talked to Dr. Facundus about that today, and he said that about this time it's normal for us to see, a 2 or 3 pound weight gain because I'm adding back on water. He said you're not gaining fat because you're not taking enough calories or consuming enough food products to gain weight, or gain fat, but that I would gain water, and it was normal in this stage of the game. So it should balance itself out, and then we should start seeing the actual weight or fat loss. Of course, I need to exercise, walk up to 30 minutes at a time, 5 to 6 days a week. And I've been doing like 20 minutes now, so I'm going to go ahead and increase that to 30. And he actually said that I could do Zumba fitness, so I'm excited about doing some Zumba. He said as long as I didn't lift or strain, I would be okay. So there's no lifting in Zumba, so I think I'll do that. And a Zumba class, you can burn 800 to 1,000 calories in an hour. So maybe if I do something like that, it'll really help. Now, I'm not going to do anything that's going to cause me to hurt. So if I go to Zumba class and I start to hurt, then I'll just stop. It was, I guess, determined through my blood work before my surgery that I had anemia, which means my iron count was really low. Looks like my B12 deficiency and my iron deficiency has been resolved, and so I am no longer anemic. Yay! I didn't even know I was anemic, but I'm no longer anemic. My blood pressure, I went to my regular physician yesterday, and my blood pressure has gone from being a normal of like 170 over 90 or 100. Now I'm 126 over 79. That's almost perfect. So no medicine, no blood pressure medicine at all. I'm not on any kind of medicine at all. Nothing. I don't need pain medication. I don't need anything. And like I said, tomorrow is my 3-week surgiversary. So I'm real excited about that. Then I'm taking my vitamins, my multivitamin and my calcium. I still have a calcium deficiency. It actually said my calcium deficiency was worsened, but I'm thinking they took some blood from me like the day I left the hospital after my surgery, and I think that's where these results are coming from, because before that time I had not had any milk or cheese or anything at all. So of course I think it would be worsened because I really had not been participating in anything besides water and protein shakes. That's all I was taking. So it says to improve that I need to if you're wondering why I'm looking down, I'm looking at my piece of paper I got from the doctor. So but anyway, it says that 1,000 milligrams of calcium and 1,000 IU of vitamin D once a day is recommended, and also my 60 grams of protein. So they're recommending that I get 60 grams of protein every day. I read a book that said, determine how much weight you wanted to be, and whatever weight you wanted to be, then you did this mathematical calculation I'll probably post that up here on a comments section of my site and tell you what that calculation was. And I think, you know, to be where I want to be, like 135 pounds, I think is pretty fair, reasonable. Maybe more, maybe less, but, you know, somewhere in there. That I needed to have like 80 to 90 grams of protein. So anyway, right now I'm just going to really concentrate on getting the 60 in. I bought some Undri products and some unflavored that I can mix in yogurt, and some chocolate Splendor that tastes just like chocolate milk. So those ought to be pretty good. Any hoot and holler. So I'm from the South. So we got to exercise. We got to keep taking our vitamins. Make sure we take our calcium. Oh, and he moved my iron from once a day to once every other day. So that should be good. And besides that, I feel great, y'all. I feel fabulous. I just do. I feel fabulous. I don't hurt anymore. I did hurt for like a week and a half, almost 2 weeks with my side. It hurt. And I had to call in for more hydrocodone. And now I've taken that, and now I have half a bottle left that I'm going to keep for a rainy day in case I have a bad headache or something. But I don't have sinuses. I don't have headaches. I don't have acid reflux. I don't have high blood pressure. Evidently, I don't have anemia. Yay. So, I'm healthy. I'm happy. And hopefully I will continue to lose weight, and you'll see a smaller me each and every time. I'm gonna get this chin to go away. We'll be doing pretty good, right? I can't wait to get to April and May and look back at myself and see these videos and think, wow, Mary, look what you've done. So, one thing I want to tell you, if you are interested in having the surgery, if you're scared about having the surgery, if you're worried about having the surgery, don't be. Have the surgery. If you're wondering if you should do lap band or gastric bypass, it's your choice. For me, it was gastric bypass because I really needed to control my sugar intake. And I knew if I still had the freedom to drink sweet tea, or if I still had the freedom to have a little bit more of that pumpkin pie or whatever pie or cake that I could, that it wouldn't work for me. So I'm glad I went with gastric bypass. I don't feel that other stomach. Sometimes I hear some rumbling down there, but you know, and I think, oh, haha, that's my large part of my stomach. I still have a stomach. I still have the whole stomach that I went in surgery with. It's just kind of divided up. Everything, all of my plumbing is working just fine. Outside of that pain I had in my left side for about 2 weeks, I'm perfect. There goes my puppy. Anyway, I hope that you benefit from these videos. I hope that friends and family can see that I'm doing good and check in with my progress. And I hope that one day I can look back at these and think, wow. Okay. Have a wonderful day. And keep your spirits high. And know that you too can be successful. And know that we're going to be successful together. And thank you to my YouTube community. Thank you to Anumi 1109. Thank you to Lose a Lot Care Bear. Thank you to Watch Me Get Skinny. Thank you to all the great people. Lauren's Weight Loss Journey. Thank you. Because I feel like I'm not alone. And I've been to support groups and they've been good. But they're nothing as comforting as these YouTube videos. Okay, take care. Bye-bye.